And so I'm not going to go into too much detail on this slide, but as Dr. Marks mentioned, there's as far as obtaining molecular testing, this can be done on the tumor or the tissue or in the blood, also known as a liquid biopsy. So let's get into looking at an example of a molecular testing report on a patient who had a tissue biopsy. So this is an example of a patient who had their molecular testing performed on tissue. So this is a summary page of a patient whose tissue got sent to Tempus for molecular testing. Starting off on the corner here, usually on the summary page, we'll have information about the patient, including their name, date of birth. And then in this section here, there's a section summarizing the tests that were ordered by the physician, as well as the date that was completed. Here, what you can see is that there's a number of tests that were ordered. For example, when we send tests to the company Tempus, the XT refers to the DNA sequencing and the XR refers to the RNA sequencing. And then the bottom part of this summary then shows the overview of what the results are. So here, what we can see is that as far as the biomarkers that came up on this test, they're listed here in the middle of the page. And this patient had an EGFR mutation. And with that, it's shown in this in the summary page, as well as the approved therapies that are available. And we'll go into more detail about the report in the following slides. So we were looking at the summary report, but when we're looking at the molecular testing report, it's many pages. And as you're going through, the molecular testing report, they can become very detailed. So, beyond the summary page, there can be the report for each specific test. So here on the top right corner, you can see here, there's the XT. So this is the molecular testing report for the DNA sequencing. So on the top, it shows that this is the XT report. And then here on the left side, it's also specifying which molecular testing this which specimen this molecular testing was performed on. So it's indicating that this was performed on a right upper lobe lung biopsy. And then usually it'll also specify when that biopsy was performed. Here in the Genomic Variants section, I would say this is probably the most important part because this is what's highlighting the genomic alterations that were found. So as far as the genomic variants goes, you can see here that in the potentially actionable section, this is listing the alterations that are found on this specific tissue biopsy that have any associated therapeutic, diagnostic, and/or prognostic indications. So here, this patient has an EGFR mutation. On the bottom of that, there's also a list of biologically relevant alterations. So this patient has a biologically relevant RBM10 mutation, but biologically relevant alterations don't have associated therapeutic, diagnostic, or prognostic indications, but they're listed there because they may have biological significance. Going into a little more detail about the actionable mutations that are reported. So when we're looking at the report here, this is indicating that EGFR is the gene that is mutated. But the EGFR is just referring to the gene, and it gets very specific because there are different types of alterations even within the EGFR gene. So after that, what we can see here is that this report is describing the kind of DNA change that we're seeing in the EGFR gene. So here it's indicating that it's an L858R mutation in the EGFR gene. And here on the right side, the report also mentions the variant allele fraction, which is the percentage of this variant mutation for the EGFR gene. And I will have to say that, as far as the details of this report, generally when we see an actionable mutation, we will think about what targeted therapy would be a good treatment option for a patient. Variant allele fractions so far in lung cancer don't play a huge role in influencing our treatment decisions because, while it's reported, it's not information we necessarily use because if a mutation it's there, and we use that information to guide our treatment decisions.